Across the globe, a staggering 10% of people grapple with a silent burden of chronic kidney disease. Yet tragically, each year millions die. This happens mainly because of not managing the condition well or getting the right treatment, which can cause kidneys to fail. It might sound scary, but if you have CKD, you can take steps to protect your kidneys. So in the next few minutes, we're going to share effective ways to manage CKD, with the last one being the most serious option. To take care of your kidneys, it's important to be mindful of what you eat. When you eat, your body breaks down food into small molecules like sodium, potassium, and protein. These molecules enter your blood, and when your blood goes to your kidneys for filtering, it can stress them out, especially if they're not working well already. So eating mindfully means being careful about what you put into your body. For instance, try to eat less sodium by avoiding foods with added salt, like frozen meals, fast food, and canned soups. Watch out for salty snacks, processed meats, canned veggies, as they also have added salt. It's also wise to steer clear of high potassium foods like bananas, oranges, potatoes, spinach, and tomatoes. Too much protein can also be tough on your kidneys, causing waste to build up in your blood. So be mindful of your diet to keep your kidneys healthy. Once you fix your diet, the next step is to look after your blood pressure levels. You see, a recent study found that high blood pressure is the second leading cause of kidney failure in the United States, following diabetes. If you have chronic kidney disease, having high blood pressure increases the chances of your kidney disease worsening and can lead to heart problems. However, managing blood pressure with CKD can be challenging for many patients. Typically, people with kidney disease should aim to lower their blood pressure to below 140/90 millimeters of mercury. But if you also have diabetes, it's recommended to aim for an even lower level, below 130/80 millimeters of mercury. Lowering blood pressure helps protect your kidneys and your heart, reducing the risk of complications. So if you have CKD, it's important to work with your healthcare team to manage your blood pressure effectively. Maintaining stable blood pressure might be challenging compared with your water intake, where doctors often advise chronic kidney disease patients to be careful about how much water they drink. A 2021 study published in Oxford Academia found that the relationship between plain water intake and the risk of kidney failure in CKD patients is like a U shape. This means that having too little or too much water might not be good for CKD patients, as it can lead to dehydration, causing urine to become concentrated with minerals and waste products, which can form kidney stones. On the other hand, drinking too much water can strain the kidneys as they try to remove the extra fluid from the body. If the kidneys can't handle it, the excess fluid can build up in the body, affecting other systems. So CKD patients need to balance their water intake carefully to support kidney health. Now let's get into some serious discussion. It's a fact. Diabetes can cause big problems, especially for your kidneys. Think of your kidneys as having millions of tiny filters called nephrons. But when your blood sugar stays high because of diabetes, it can hurt these filters and the blood vessels in your kidneys. This makes them not work as well as they should. Also, many folks with diabetes get high blood pressure, which is harmful for the kidneys too. To stop or slow down kidney damage, the key is to keep your blood sugar in check. By doing this, you're giving your kidneys the best chance to stay healthy. While you're listening to the do's and don'ts, if you find this video helpful, don't forget to subscribe to our channel, Natural Education, for more useful content. We can all agree that smoking is awful, and it's like buying poison that harms you, especially if you have CKD. Even being around secondhand smoke is harmful for CKD patients. You see, smoking speeds up kidney disease and raises the risk of kidney failure, and some research even says that smoking leads to a decline in kidney function. Additionally, CKD raises your chances of serious health issues like high blood pressure and heart disease, which affect blood flow to the kidneys and overall kidney health. Since CKD already compromised kidney function, taking the risk of smoking could permanently shut down kidney function. So it's vital to avoid smoking to protect your kidneys and overall health. Ask yourself, is it really worth it? I trust this wealth of information isn't putting you to sleep. But hey, when it comes to your well-being, catching quality Z's isn't just important, it's kidney saving. Research has shown that lack of sleep and sleep problems are linked to higher rates of diabetes and heart issues. In fact, new research from Kieran McMullen at Brigham and Women's Hospital suggests that sleep is closely tied to kidney function too. It was found that poor sleep increases the risk of developing chronic kidney disease. And if you already have CKD, not getting enough sleep can make it worse. So it's essential to make sure you're getting plenty of rest. This can help manage CKD and also reduce anxiety and other health problems. Make sure to prioritize your sleep for better kidney health and overall well-being. The next important factor in the equation is exercise, and regular exercise is crucial for everyone, including those with kidney disease. Exercise offers many benefits, such as better muscle function, improved blood pressure control, increased muscle strength, lowered levels of blood fats like cholesterol and triglycerides, and better weight management. For individuals with CKD, maintaining muscle mass and strength is often a challenge, given the presence of protein energy wasting. However, incorporating resistance training into their routine can make a world of difference. Studies have shown that engaging in resistance training 2 to 3 times a week can lead to remarkable improvements, increasing muscle mass and strength by 20 to 30%. This not only combats muscle wasting and weakness, but also boosts functional capacity and overall quality of life. Now, if you neglect to follow any of these tips for managing your kidney function, you're gradually losing ground, and the final option is to undergo invasive medical procedures. For some people with chronic kidney disease, their kidneys will eventually stop working, but this usually happens slowly, allowing time to plan the next steps for treatment. One option at this stage is dialysis, a way to clean the blood by removing waste and extra fluid. There are 2 main types: hemodialysis, where the blood goes through a machine outside the body for cleaning, and peritoneal dialysis, where a special fluid is put into the belly to absorb waste from blood vessels lining the inside. If dealing with kidney problems gets too much, another choice, instead of dialysis, is a kidney transplant. This can be the best treatment for severe kidney disease, but it involves major surgery and taking medicines forever to stop the body from rejecting the new kidney. Living with one kidney is possible, so kidneys for transplant can come from living or recently deceased donors. However, there's a shortage of donors, and you might have to wait a long time, possibly months or even years, for a transplant. While waiting, you might need dialysis, but by following the management tips mentioned earlier, you can avoid reaching this critical stage. You can also opt for kidney detoxification to prevent reaching the stage of chronic kidney disease. If you're interested, check out this video, Best 6 Drinks to Detox and Cleanse Your Kidneys Fast.